patient that has reduced functional ability. So we would teach the patient and we would explain why a walker is being used. We would also teach the patient on the different types of walkers. We would emphasize proper posture and position. We would match walker's choice, the walker equipment to the patient's goals. We would also teach safe use and progression. So some of those are proper hand placement, safe weight shifting, turning, stopping, navigating different surfaces like stairs, curbs, and uneven grounds. So we have some contraindications that we'd like to go over. There are inadequate balances with patients, insufficient upper extremity strength. We want to make sure that a patient can push into the walker and alleviate some of that pressure on that affected leg. So having that good upper body strength is essential for walker usage. Inability to follow weight bearing precautions, so we definitely don't want them to break their precautions set by their physician. Poor coordination, insufficient lower extremity strength, severe pain, or an unsafe stair environment. We want to make sure that they're good, solid, even stairs and train them to navigate that. Yes. So some precautions that we would like to go over with our patients is a standard walker should be folded before stair climbing. So that's thought out before the action of climbing the stairs. You would use the handrail when available. You would also place the walker securely before moving. In ascending and descending the stairs, it would be one step at a time. So not thinking about 3 or 2 steps at a time, but one step at a time. We would emphasize maintaining the patient's weight bearing status, whether that's partial or non-weight bearing. We would also emphasize up with the good and down with the bad, and we would not encourage the patient to go up the stairs if they're feeling dizzy or feeling like they're feeling weakness or fatigue. So some good interpretations for the patient. You need to cover a few of them already, so we want to emphasize up with the good when they're going up the stairs and down with the bad when they're descending the stairs. Keeping that center of gravity forward. When they're ascending the stairs, you want to make sure that they know not to lean back because they could fall backwards. That's a no-no. Using the handrail when available. That's a huge one. The handrail is the most stable surface when ascending the stairs. If available, we want to teach patients to reach for that first and using that assisted device to further aid them if one handrail is available. So we want to make sure that they know how to navigate that situation. Emphasizing looking towards the next step versus looking at the feet. And then also making sure that they pause if they feel dizzy or fatigued. So right now, we are going to show you how to ascend the stairs with the use of a walker and a PT.
Okay, so first things first, we are going to put the gait belt around the patient, making sure that it is nice and tight. 2 fingers can fit within the gait belt, and we are going to assure that we are using that for assisting with stepping up and going down the stairs. So this is the walker. We're going to place the patient in front of it, measure the length with the wrists, and she's good to go. And then this is how it should be placed within each step. This is the posterior view. Up with the good, down with the bad. So now this is the walker. This is how you close it. This is the version where you go up the stairs with the walker closed. And the left arm will be on the railing, and the PT will have 2 points. 1 hand behind the patient and 1 hand in front of that left shoulder, making sure that you are going up the stairs safe. Now, going down the stairs, it is down with the bad. So, that left arm is on the railing, the 2 points where the PT is assuring safety with the patient and making sure that the patient pushes the walker into those corners so that there's more stability going down. Now going up, this is another version where the walker is open and making sure that it goes within the crevices of the stairs. And that concludes our video. Thank you so much.